Come on.
They're right there!
Let's go. Move, 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 move. This episode of Choices Not Chances podcast is sponsored by Louisiana Gun Shop, located on Highway 90 West in Broussard, Louisiana, just south of Lafayette. For more information, stay tuned at the end of this episode.
This is Choices Not Chances podcast with Ryan and Matt. I'm your co-host, Matthew Charette. Sit next to me is Ryan Rogers. Ryan.
All right, guys, thanks for coming back. And again, just like every other episode, if you see something on this episode that you think you can share out to somebody that can take it away, this is an episode that I'm sure just about any guy out there can take some stuff away. Today we have a very special guest. It's Dr. Judson Brandeis, MD. He's a men's health specialist and a urologic surgeon, and he's also the author of a new book called The 21st Century Man, where he talks about everything men's health that you could possibly think of, from marijuana to low testosterone to everything you could want. So, Dr. Brandeis, thanks for joining the cast and reaching out, and let's get into the book a little bit.
Awesome. Well, Ryan, thank you so much for having me on. I really appreciate the opportunity to talk to this special community.
Absolutely. Absolutely. And I've been looking forward to having you on. Your book is a behemoth to try to read. And I know we talked offline. I said I've got about halfway, and halfway is a long way. But I skimmed through the rest of what I hadn't read to make sure if I see any relevant topics to the community that I would bring it up. But why don't we just start out, if you can just kind of give me your own background and what you've been doing. I actually like to try to get a couple of questions answered at the beginning of each show for selfish reasons. I'm writing another book myself, and I like to know where people come from and where they started. So growing up, where'd you grow up? And
yeah, so I grew up in New York, the suburbs of New York. And then I went off to Brown University and did a history major. Okay. And then after that, I worked at American Red Cross in a lab where they figured out how to freeze blood. So a guy named Harold T. Merriman figured out how to freeze blood. So you can't take just blood and throw it in the refrigerator and then transfuse it into someone, because water expands and so blood cells pop. And so Harold T. Merriman figured out how to freeze blood. And then after that, I went off to Vanderbilt for medical school. During medical school, I did a year of research sponsored by Howard Hughes Medical Institute at Harvard Medical School, and I worked at the lab where they did the first living-related kidney transplant, won the Nobel Prize for that. And so then I went back to Vanderbilt, finished medical school, and then I started residency in surgery for 2 years at UCLA, and then finished my surgical residency in urologic surgery at UCLA. And then I went off and practiced in Northern California. I helped pioneer surgical robotics. I built kidney stone centers. I helped pioneer MRI-guided prostate biopsy. And then about 3 years ago, I became really interested in regenerative urology. So the ability to help men who can't get erections anymore to start getting erections again. And there are a number of new technologies: low-intensity shockwave therapy, platelet-rich plasma, stem cells, peptides, a bunch of other stuff that we can use to help men who can't get enough blood flow to the penis to get a rigid erection. And so I've been a pioneer in that field. I helped do research on PRP, or platelet-rich plasma, and shockwave therapy, and high-intensity focused electromagnetic waves. So anyway, I'm going on way too long.
No, please.
But I've done a lot of stuff, and this book really came out of seeing patients. And it started off as like a 250 page book on sexual medicine, but so many parts of men's physical health, emotional health, mental health will affect their ability to have satisfactory sexual encounters. And so I just kept adding chapters to the book, and now it's over 900 pages. It's 101 chapters. But it's not really meant to be read cover to cover. It's more of a advice book. Like if your best buddy was one of the top doctors in this field, this is the advice that he or she would give you.
No, I love it. And I know offline I said something about making it that far, and you'd said, well, it's not kind of meant to go cover to cover, but I was trying to do it just so I knew what we would be covering and get into it.
You didn't get to the whole back part of the book is all about sex.
That's what I'm saving that best for last, I guess. Yeah, we'll get to it. Look at this thickness of this, guys. I mean, we're talking about a lot of research gone into this. Multiple different doctors cited in this, 50 top doctors and men health experts, so you can feel great, look good, and have better sex. I know that a lot of people might get bashful around the pecker problem issue, but in our field, a lot of guys that get blown up or have devastating injuries, maimed parts of their bodies and things like that, go through, and especially guys that have been blown up, and maybe we can talk more on sound waves and how that kind of affects the brain and the rest of the body, but a lot of guys will come home with low testosterone counts, and it's hard for them to get those back up because of whatever reason that is, and then and then a lot of guys are pushed on medicine, and then some medicines will have side effects to where you can't get an erection, or you can't finish, or there's different side effects with different medicines and different side effects with different injuries for sure. But I felt like it was important to maybe go into some of that at depth with an expert for some of you guys out there that may be experiencing some of that. And also anybody else that for whatever reason may be having those problems, not to be bashful about it, but to get the information out there.
Absolutely. And so, that's really, really important to me, because there's so many people out there that are pushing information that may not necessarily be the most accurate information. And so this book, I gathered 50 or 60 national experts in each of their fields to provide high density information. I'm not one of those guys that writes a 500-page book that could be summarized in 4 pages. This is a 900-page book. You've read a lot of it.
I have.
You can't summarize my chapters in any less than the number of words that are written on the
they're very succinct. They're very to the point. This is the information, and it's just a wealth of it, which is great.
And it's not a C-spot run kind of book. I practice in Northern California. I have a lot of really intelligent patients, and I don't denigrate the intelligence of men. There's a great amount of information in the book, but you got to work a little to understand it. But it's really important that you put some work into understanding it, and it's important to understand these things at a slightly deeper level.
Agreed.
Yeah, because the thing is, I take care of men, and the one thing I understand about taking care of men is you can't tell a guy what to do. Right? It's not like just take this pill, you'll be fine. Because a guy would be like, no, why would I take this pill? What is it? How does it work? What does it do? Right? And so I never tell guys what to do. I provide them with the information that they need to make the most intelligent decision for themselves. And when they understand things, and when they're kind of at the knowledge level that they need to be, then they'll make the right decision.
Sure.
Like I had a patient the other day, like I wanted him to stop drinking. He was having 2 glasses of wine a day, right? And he had to lose 25 pounds. And he's like, I can't lose the weight, so on and so forth. And so what I did is I said, take your iPhone out. A glass of wine is 125 calories. 2 glasses of wine is 250 calories. Multiply that times 365, and then divide it by 3,500, which is the number of calories per pound of fat. What number do you get? He said, well, 26. I said, okay, that's 26 pounds of fat that you're putting on your body every year because you're drinking 2 glasses of wine. So if you cut 2 glasses of wine out, you'll lose 26 pounds. And he just looked at me and said, well, I guess that's what I have to do. Like I didn't have to tell him anything.
Yeah.
Right?
Yeah.
The numbers just spoke for themselves. So that's, this book is just filled with examples of that kind of stuff. Or, 90% of eye injuries are preventable by wearing glasses or safety goggles. Right? Like every weekend I'm out in the backyard with my Sawzall and my shovel and my, I like building retaining walls and block walls and all that kind of stuff. But now I wear gloves because 50% of hand injuries are preventable by wearing gloves. and I wear safety goggles because I don't want to be that idiot that loses vision in one eye because, you know, he's cutting through a piece of wood and doesn't realize there's a nail in there, and a little speck of metal comes off the back of the bandsaw and pops into my eye.
Yep. Yep.
Right. And the thing is, like, every guy's like, I can do whatever I want. You know, I'm tough, and, you know, I fought in the military, and I, you know, like, I'm a badass. But the thing is, statistics are statistics. Right. And if 100 guys are out with a bandsaw, one of the guys is going to come home with, you know, no left eye. And do you really want to be that guy?
Right. Right. Yeah, that's it's interesting. The Marine Corps got that covered. I mean, you're not allowed to go anywhere without glasses and gloves and PPE, and that's why they did it. They do, you know, risk assessments with this kind of data and say, nope, everybody will wear these, everybody will wear these, everybody will wear these, and we'll cut down 50% of our incidents.
Right.
So it makes sense. It makes sense for sure. Now, what would you say to, first of all, I want to understand shockwaves, and I want to understand what they do to the body and why they do it to the body, if you can help with that.
Yeah, so, you know, we actually discovered the effects of shockwaves during World War II. So there were folks that were unfortunately in the water when we were dropping depth charges to blow up submarines. And, you know, like, if you're in an explosion, you get shrapnel, you can understand, well, that's what the injury is from, right? But what they were finding, you know, you're not going to get shrapnel in the water, but they were finding a blast effect from the shock waves. So if you look at a sound wave has a kind of a gentle rise and fall, whereas a shock wave has a very high peak and a very dramatic drop. And so that transmits a huge amount of energy faster than the speed of sound, right? And causes internal damage to organs, because those internal organs get torn up by that energy. Okay, now, urologists took advantage of this in the 70s and to the present by using those shock waves to break up kidney stones. So we use what's called a piezoelectric, which is a crystal that sends an intense burst of energy, and it's a focused wave. So the wave gets focused, and, you know, in an average person, it's 10 or 12 centimeters in that the kidney is, and then you find the stone with an X-ray, and you focus those waves right onto the stone. And so instead of having to take a scope, putting you to sleep, sticking the scope up the penis, into the bladder, up the ureter, use a laser, break up a kidney stone, that's usually the reaction we get.
Yeah, it's not good.
You can use these pulsed shock waves to break up the stone, and then those little crumbs of stone come tumbling down.
Way easier to pee out than the whole thing.
Exactly.
Oh,
and so,
how long does it take when you focus this energy from these shock waves? How long does it take to break one up?
Usually about 15, 20 minutes. I mean, it depends on the size of the stone, how hard the stone is, et cetera, but usually about 15, 20 minutes.
And how many waves a minute are hitting it?
Usually we do about 3,000 waves. That's the most waves you can safely use to break up a kidney stone. And we go at a rate of about 100 a minute. So it's about 30 minutes. I mean,
100 a minute for 30 minutes.
Up to about 30 minutes.
And you find, like, so somebody did research that says if we do 4,000 waves in 5 minutes, it's bad.
Well, you can cause damage to the kidney if you use.
Right. So you can actually hurt the actual organs then.
Yeah.
Okay. Yeah. Check. Now, would it be safe to say then that the blast from, say, an IED or a mortar, one of these weapons, the blast that is going through to these troops, is that doing damage, high intensity damage to their brains and organs?
Of course.
Every blast, right?
Of course.
Yeah.
You know, did you see that explosion that happened in downtown Lebanon?
Yes.
It's really amazing. If you watch that again, you'll see the building just turn white. And then you actually can see the wave, the blast wave, the shock wave, and it just flattens buildings as it goes.
Yep.
Right. And so it's an invisible wave, really. But internally to the organs of the body and the brain and the pituitary and everything else, you know, it could be devastating.
Now, and this is, I'm just spitballing here. if somebody has been blown up and those waves have hit the brain, do you think that those wave damage could have the propensity to cause CTE or long-term damage as far as graying, permanent bruising of the brain?
So, the brain is an incredibly complex organ. It's made up of neurons, right? So neurons are really delicate cells, but really the brilliance of the brain is the interconnectedness of the neurons, right? So there's maybe hundreds of millions or maybe billions of neurons. I mean, a neurosurgeon will know better than me, right? Inside a cranium. So, and then it's kind of interesting. I'm really into artificial intelligence, right? So why can't we make a computer the size of a brain that will outthink a brain, right? It's, because the brain functions, functions at like 200,000 hertz, right? But a little Pentium chip will be at 4 megahertz, 4 million hertz, right? And the brain, the cranium's only a certain size. You can't make brains bigger than your cranium, but you can have a server farm, with hundreds and hundreds of computers that are all linked together. But really the brilliance of the brain comes from the linkage of the neurons to each other. So, a single neuron could have hundreds, even thousands of connections to other neurons. And that's, as from what I know about neuroscience, that's really the brilliance of the brain. But if you have a blast coming through your body and through your brain, it just makes a whole lot of sense to me that it's going to dislodge a lot of those cell-to-cell connections that's in the brain, that, things that won't show up on an MRI or a CAT scan, but they're going to show up, when you show up at home and you don't remember somebody's name, or, you're having trouble filling out a job application or trouble remembering something, that's where those kind of injuries are going to show up.
For sure. Memory issues for sure with guys that have been blown up. Myself as well, I have issues where sometimes, like, I'll have a conversation with my wife and 10 minutes later, I don't have a recollection of that. It's not that I didn't remember what she said. I don't ever remember having that conversation, period. And that's been like a growing thing for us to learn how to, sort that out. And it turns into whiteboards and calendars and day planners all over my house.
Yeah.
Basically.
And, the thing is, it's interesting. Like, if you've ever drank too much and you quote blacked out, or you have no memory of what happened. So it's not that you weren't actually conscious when that was going on. It's that when you drink too much alcohol, your brain can't imprint those memories into the hippocampus, into that part of the brain that records memories. And so, it may be that you had part of your recording apparatus damaged during a blast. And so it's not that things aren't happening. Like, you could watch a videotape of yourself 10 minutes ago and say, gosh, that actually really did happen. But
just not getting recorded.
You've lost some of the ability to inscribe that into your brain consciousness.
I think some of it, this is just me, and I'm no expert, but I think some of it is necessary, which makes it, to me, like a built-in, a built-in safe, fail-safe mechanism. Like, we know that was a traumatic experience you just went through, and we don't want you to relive that. So we're going to spread load that file through 3 million files so that you have trouble putting all that together, because it will be damaging when you go back through it. And maybe that's just our evolution of our brain and of our being, to know that those are the things that hurt us when they're brought back up, so we need to not remember them correctly. And then you spend your life through counseling pulling those out and trying to remember it correctly. But I think that some of it's probably by design and probably necessary by design. But when you have the injury and you can't get a good answer, which goes for a lot of guys out there that are suffering with brain injuries from TBI and blast exposure, it's like there's not a good answer. And when you don't get a good answer as like a highly functioning athlete, you need a good answer. And people don't think about Marines and soldiers and airmen and guardsmen, as and sailors as highly functioning athletes, but that's what they are. They're highly functioning athletes.
Oh yeah, absolutely.
And,
in fact, I have a clinical research study on industrial athletes, and I consider fire, corrections, SWAT, police, military as industrial athletes. It's using this really amazing technology called HIFEM, high intensity focused electromagnetic waves, to build muscle. And I can build muscle 10 to 15 times faster than you could do in the gym.
How do you do this?
It's using it's a device called the M-Sculpt device.
Okay.
And it really, they should have them in VAs to help people rehabilitate from injuries and so on and so forth. The technology is just incredible.
Do they have them, or are you saying they do have them, or they should have them?
They should.
Okay.
Absolutely. They should. But it uses electromagnetic fields. So there are things called TENS units.
Yeah,
right?
yeah, I know TENS.
Right. But TENS is a direct current. Right. So it's point to point.
Yeah.
And so it goes through the skin, and the pain fibers are very superficial in the skin. So these things generate heat, and it's uncomfortable. And then the other thing is that the electrical current goes very superficially through the muscle because it goes through the path of least resistance. So M-Sculpt or HIFEM is electromagnetic field. So if you run electricity through a coil, it creates an electromagnetic field, and then you can set the depth of penetration of that electromagnetic field to contract muscle.
So they just use the fields to contract the muscle, and they can put it on.
Yeah.
What did you say, 30% faster or more?
I had a San Francisco SWAT guy the other day. So I brought him in for the protocol is once a week for 6 weeks. And then I do body composition scans on everyone. And he put a pound of muscle on each arm in 6 to 8 weeks.
Now, was he damaged, or is he coming in to get stronger?
No, he's coming in fine.
Just coming in healthy, but wanting to get stronger faster.
Healthy. Yeah, he's coming in healthy. He's working out. That's what they do as part of the SWAT team. It's part of being able to be on those SWAT teams is training. And using this technology, I built an extra pound of muscle on each arm. So, a muscle arm has about 12 pounds of muscle. A big arm. My arm's probably
not mine, guaranteed.
8 or 9 pounds. Yeah. And he went from 12 to 13 pounds. So myself, I went from 8 to 8.5 on one arm, and like 8 to 8 3/4 on the other arm.
Wow. Just
by doing this, which is just basically passively lying there and letting the high intensity focused electromagnetic waves do the work for you. All the Hollywood movie stars now that have 6-pack abs, they're all using this now.
They're pushing a button and laying there. Get some.
Yeah. I even have some professional athletes that come in. But if you're younger and you're a professional athlete, you're able to build muscle much faster. So my practice mostly focuses on guys over 40, especially guys over 50. And there was an interesting study I just read that given the same exercise routine, 20-year-olds will build muscle 3 times faster than 50-year-olds. Right. So, you get to a point in your life where you're what we call catabolic, meaning you're losing muscle. So anabolic is building muscle, catabolic is losing muscle. Right. And, that happens to everyone. No one gets out of this alive. And so, especially after the age of 60, guys really, the catabolism accelerates. And so you have to be smart if you want to continue to have a high content of muscle, low content of fat in your body, and you want to remain really physically active.
Yeah, I know that. I was talking to one of my interviewees, one of the guests that I had on recently, and I said, if you could change anything, what would you change? He said that, and if I could change anything and go back on my career, I would be better at my job from the beginning if I knew then what I know now about how to eat and how to hydrate and how to take care of myself and how to be healthy. And I'm no expert, but I have learned what's good for my body and what's not been good for my body along the way, and I got it. Obviously most of you guys are right about your diet, about what you should have in you. about your gut acid, about your mental health. And so there's just a lot that goes into it that I didn't know when I was growing up, early in the Marine Corps and, in my day. And it's like I could have made myself a machine if I just would have had the knowledge at an earlier time.
But, the interesting thing is in your 20s and 30s, it really doesn't matter what you do. Mm-hmm. I tell people, you want to build muscle in a 20-year-old, send him to McDonald's and send him to the gym.
Yep.
Right. Yeah. I mean, you could do anything at that age. Right. You're still going to get it. But the thing is, the 50-year-old you is not going to be happy with the 20-year-old you or the 25-year-old you if you're doing stupid things like drinking too much or smoking or doing drugs or eating too much food, right? Because you're going to pay the price 20 years later. In your 20s, whatever, like I used to go out till 2 o'clock in the morning and then I'd show up for rounds at 6 o'clock in the morning and I'd get through the day, no problem. But, I couldn't do that now. I'm 55. Right?
Oh, yeah.
I feel like exhausted for the rest of the week.
Yep.
And so, that's the advantage. That's the benefit of getting into healthy habits. It's not for helping the current you. It's helping the future you.
Yep. Making sacrifices when you're young for your older self.
Yeah. I mean, it's for you, but it's a different you.
Just later. Yep.
It's a later you.
No, but you'll appreciate it. You'll appreciate it when you get there.
I mean, the thing is, if you're 55 and you can't get it up anymore with your wife, then you're going to be cursing your 25-year-old you.
Yeah, 100%.
For going to Kentucky Fried Chicken too much and smoking and, doing all the things that all the things
that felt good at the time.
I mean, at the end of the day, you could really summarize the book and like, don't drink, don't smoke, don't do drugs, don't eat too much food, exercise every day, stretch every day, do some meditation, and be nice to other people. Right? I mean, if you did that, you're ahead of 90% of people. You're going to live a pretty good, healthy life. But the 100%. Problem is, life gets in the way. There's stresses and we need coping mechanisms and so on and so forth. And so, it's harder.
Interesting. One other thing I wanted to talk about that we talked offline, and maybe we can talk on it for, the last 15, 20 minutes here. I know you got to go at the end of the hour, but a lot of veterans are living in states where they're able to use cannabis for anxiety, depression, things of this nature, and also able to use it as a medicinal or recreational. But a lot of the guys that I'm talking to are finding great making great strides coming off other narcotic medicine, other opioid medicines by medicinally taking cannabis. And you had a chapter on it. We talked a little bit offline about it, but get into your research on that chapter, what you found about it, and then kind of what we were talking about before. Let's just kind of caption over or gloss over what you got for it.
Yeah, I mean, when I wrote that chapter, I was trying to find someone else who knew a lot more than me about cannabis because I really don't know that much and I don't have much experience with it. But I couldn't find anyone else to write the chapter, so I wrote it. And I went into it expecting to find a lot of bad stuff. And at the end of the day, I really didn't find that many bad things about it. What I learned was that there's THC, which is the hallucinogenic part, and there's CBD, which has more sort of medicinal qualities. And so I'll separate the CBD, which I think, as far as I understand, is perfectly fine, from the THC. Now, back in the Woodstock days, people were smoking marijuana that was 2 or 3% THC. But because of technology and because of dispensing pharmacies and so on and so forth, or dispensaries, the THC content has gone way up. So, the people that are smoking marijuana today are not smoking the same marijuana that they were smoking in the 60s, right? They're smoking something that's a lot more intense, and that has a lot more effect on brain development. We were talking about, if you're a teenager and you're smoking THC, marijuana with a very high THC content, that's not going to be good for your brain development.
Right.
Once you're 25 and your brain is fully developed, what you do at that point is less consequential than it is when your brain is developing.
Right.
Okay. And then finally, you and I were also talking about people that sell the stuff, cut other drugs into marijuana. So they cut fentanyl into marijuana, and people die from that. I had a patient, I got called 2 o'clock in the morning because some guy tried to cut his penis off. Right. So I woke up at 2 o'clock in the morning.
I read that in the book. Yeah, the italic so the story. I was like, oh my God.
And it just so happened that the guy's father was one of my patients. I was kind of grumpy and pissed off. Someone got me up at 2 o'clock in the morning to have to go do this. But I went down to speak with the father, and I kind of got myself in a more empathetic place. And then I had this really nice heart-to-heart talk with the father, and he said, my son was like a superstar until he was 16, and then he started smoking marijuana, and it gave him a schizophrenic reaction. And I don't know if that's his own unique physiology or whether there was some other drug that was cut into the marijuana that he was using, but he said ever since then he's not been the same kid. 3-4 years later he's trying to cut his penis off.
What did he try to cut it off with? Like scissors?
A knife.
Oh my God.
Yeah. I mean, you've seen.
He just tripped out in his head and.
Yeah, just tripped out in his head.
Oh my goodness.
So, but honestly, I'm not the world's expert on marijuana, and that's about the limit of the really intelligent things that I can say.
I need to do it. I need to find an expert, maybe from Canada or I know they've had, the reason I say Canada is because they are way ahead of us as far as medical marijuana goes, and having actual marijuana doctors that understand the science, understand how to help you with your exact issues and what strands. And I need to recruit and get one of them on that really know.
But I love to talk about testosterone, which we were talking about.
Yes, sir. I want to talk about that as well.
Yeah, because that is the most important growth hormone for men. Right. So you're 12 years old, your testosterone's low, you're this little scrawny punk, and then your testosterone shoots up the next year, and within 4 years, you're 6 foot tall, you're muscular, your voice is low, your penis grew, your libido's through the roof, and it's just because your testosterone went from 200 to 1,000.
Yeah.
Right. And so then at the age of 20, your testosterone should be around 900 or 1,000. And it will go down 1 or 2% per year after that. Right. And so, women have menopause where their estrogen plummets.
Yeah.
Men have what's called andropause where their testosterone slowly goes down. But there are situations like blast injuries, or other types of injuries, or people that don't take care of themselves like they should. For example, you'll see headlines every once in a while. The average testosterone levels for men these days is 30% less than it was 50 years ago. Right. And how come that is? Well, first of all, the brain is smart. Right. The brain will only make as much testosterone, or tell the testicle to make as much testosterone as it needs. Right. So if you're a hunter back in the day, when you were a caveman and you were taking down wild boar on the plains, you need a really high testosterone because wild boar don't like to be killed. If you're a farmer, farmers work hard, but they're not, taking down wild boar. Your testosterone is going to be high, but not quite as high as a hunter. And if you sit behind a computer all day, your body says, well, I'm not attacking anyone, and I'm not lifting bales of hay, so I don't need that much testosterone. So why bother? And so guys' testosterone's lower than it used to be. And then we live in a world filled with, plastics and processed foods and so on and so forth. And so, that there is a correlation between those kind of things and low testosterone. And then the final thing is sleep.
Yeah.
Right. So if you look at how testosterone varies on a daily basis, it's highest at 8 o'clock in the morning. Right. And then it declines as the day goes on, bottoms out at about 4 o'clock in the afternoon, and it doesn't go back up until you start to go to sleep. Right. And then when you go to sleep, it goes back up. So if you're not getting good sleep, or you're not getting enough sleep, or you're drinking late at night and that interrupts your sleep, guess what? Your testosterone's not going to get up to the level that it really should get up to.
Mm-hmm, mm-hmm. And if you're somebody that is experiencing low testosterone, let's say right now there's guys in my audience that are experiencing low testosterone, what advice would you give them?
Okay, so, first of all, you need to check the testosterone and check it first thing in the morning, and check it not only a total testosterone, but also a free testosterone. Okay, and I want to invite everyone out there, go to my website. It's called brandeismd.com, brandeismd.com. Go to the media tab and drop down to ebooks. Okay, I wrote 3 ebooks on testosterone, right? One is, generally about testosterone. The second one is the levels that you can expect from all the different testosterone preparations. And then the third is for the bodybuilders and people that want to use performance enhancing drugs, right? Because I've seen a lot of guys really, really mess themselves up by using those things. And I want people to be able to do it. If you're going to do it safely. Right. And the ebook explains everything and explains how to do it safely.
Now, that's something that you put also in the the email that came to me, said that you wanted to, address the swelling issue of, the rise of anabolic steroids in first responders, military community. Can you breathe on that a little bit?
Yeah, so it's very surprising to me that how many first responders use anabolic steroids, right? And it's kind of like, if you look at a woman and you think, wow, are those fake breasts? Yeah, they're probably fake breasts. Yeah. If you look at a police officer or a fireman and you're like, damn, that guy is huge. I wonder if he uses anabolic steroids. Yeah, he probably does, right? It's really hard to build that kind of bulk without anabolic steroids. And the problem is, right, that you're going super physiologic. So when you're 20, your testosterone's like 1,000. But a lot of these guys are going to 2,000 or 2,500 or 3,000. And the thing is, so that you got to understand, the brain sends a message to the pituitary, which sends a message to the testicles to make testosterone. Testosterone in sperm, that's what the testicles do, okay? Then there's what's called a negative feedback loop. So there's a sensor in the brain and in the pituitary that says, we've made enough, we're not going to produce any more, okay? Now, if you're getting testosterone from the outside, those sensors will say, we've made enough, we're not going to make any more. And if you keep getting testosterone from the outside,
it's going to shut off.
Then it's going to shut off. So I saw a guy, he used to play for the Raiders for 15 years. The guy's like 350 pounds, huge. And I did his vasectomy, and his testicles are the size of marbles, right? But I mean, this guy could squash me, with his left pinky, right? And so the problem is he's taking huge amounts of steroids, but he's not doing anything to protect his endogenous, his own testosterone production. And so there are medications like Clomid or like HCG that you can take to protect your testicular function.
Check.
The other thing is there are guys that are taking high doses of testosterone and they end up with man boobs, right? Yeah. They're big guys, but they have breasts. Right? And that's because testosterone and estrogen are virtually the same molecule. Even though men are from Mars and women are from Venus, the only difference between testosterone and estrogen is a single hydrogen ion. Okay. And so it's easy for your body to convert testosterone into estrogen, right? So you have to take what's called an aromatase inhibitor to block the conversion to estrogen, and you need to be checking estrogen levels to make sure it's not too hot.
Right. I wondered that myself. I never understood why that worked or how that worked.
Yep. And so, these are very complex but understandable systems, and there are ways to use testosterone safely. But if you don't use it safely, you can shut down your own production of testosterone. You can make yourself infertile, and you'll get to the point where you have a large collection of Bette Midler and Barbra Streisand albums.
I like it.
And really, none of those conditions are amenable to...
not ideal to what we're looking for.
Yeah, not ideal to what we're looking for.
Not at all. Not at all. Well, once again, guys, Dr. Brandeis, the 21st Century Man. Go get it. It's at your local Barnes & Noble and all your bookstores. You can also get it online. And go to his website and pull up some of those ebooks if you're interested, or if you have low T, or if you're dealing with low T, you're a veteran, you're a guy that's been blown up and you want to know more about it. That is your roadmap to success right there. Also, the book is worth having and worth throwing up on the shelf because you can always reference back to it when you have other questions. That's what I'm going to do.
So can I go back to testosterone for a sec?
Oh, yep, absolutely.
Yeah, because the thing is, so you got to check your levels, okay? And you got to check the free testosterone, because the free testosterone really is the active form of testosterone. But then you also have to look at yourself clinically. So just because your testosterone is low doesn't necessarily mean that you need testosterone, right? If you're clinically low testosterone, right? So if you're grumpy, you're depressed, your mood is bad, you're losing muscle, you're putting on fat, your libido is low, you have man boobs, that's the reason to go on testosterone, right? If your testosterone's 200, but life is great and I'm having sex with the wife or with my partner and, I can do everything I need to do, then don't bother going on testosterone and don't have anyone convince you to go on testosterone because it's probably not the right time. But if you do go on testosterone, right? So I used to think, let's get someone back into normal range. Normal range is 400 to 600, right? But I've discovered that's wrong, okay? My guys do great when I get their testosterone levels between 1,000 and 1,200, right? That's the level that you were at when you were 20 and you felt great. If I get you to the level that of a 55-year-old or a 60-year-old, great, who cares?
Yeah.
If you want to build muscle, if you want libido, if you want to feel great, if you want your mood to get better, if you want to sleep better, if you want your aches and pains to go away, you got to get to 1,000 to 1,200, right? And so there are some potential side effects of that, which are elucidated in the ebook and also in my book. And basically, it's prostate growth. It doesn't cause prostate cancer, but if you have aggressive prostate cancer, you don't want to be on testosterone. You may develop some acne or some oily skin, and you may lose a little bit of hair on your head. And that's pretty much the downside of testosterone. It's actually a very safe, I don't even want to call it a drug because it's not. It's a hormone.
Hormone, yeah.
Right? So you're not taking a drug. I mean, what I say is any guy with a bat and two balls is going to do great on testosterone. And actually, even women do great on testosterone. It's really funny. I get these old guys coming into my office saying, my wife just got on estrogen, progesterone, and testosterone, and she's chasing me around the house.
Good.
Doc, you got to do something for me. Yeah. And so, I get them on testosterone, and you got a happy couple after that. So, if I would say, any veteran that's feeling low energy and losing muscle, building up fat, depressed, testosterone is one of the greatest antidepressants ever invented. Get your testosterone checked and insist on getting testosterone replacement if it's appropriate, and insist that levels get to about 1,000. Right? Sure. The medical community, I'm a little bit of not an oddball, but I'm a little out of the norm in the medical community. And I used to be sort of in that medical community where it said, just get levels back to normal. But I've treated hundreds and hundreds of patients now with higher levels of testosterone. I can tell you it's safe and it's highly effective. And guys come back and their lives are just really transformed.
Check. You also sent me with the book some A-Firm. Do you want to cover that? What you think about it? Yeah.
So, nitric oxide. When I was at UCLA, one of my professors won the Nobel Prize for discovering nitric oxide as a second messenger. And then one of my good buddies wrote the paper that described the mechanism of action of Viagra. And it works through a pathway that's activated by nitric oxide.
Okay.
Right. So it's not nitrous, the stuff you get at the dentist, but it's a little molecule that is released from nerves, and when it's released from nerves onto blood vessels, it opens blood vessels. So it improves circulation, and it improves circulation all throughout the body. So it improves circulation for athletes. So most competitive bodybuilders will use a nitric oxide booster in their pre-workout stack. Almost all elite endurance athletes will use nitric oxide boosters. It improves brain circulation, and it improves blood pressure. So I get a lot of my patients off blood pressure medications by being on a nitric oxide booster. And, it's great for erections.
Well, there you go.
And it's synergistic with the PDE5 inhibitors. So the way that a nitric oxide booster works is it makes this stuff called cGMP. And the way that Viagra works is it blocks the breakdown of cGMP.
Yeah.
So the nitric oxide booster and the PDE5 inhibitors work well. Like a lot of guys will say to me, well, Viagra used to work, but it doesn't seem like it works as well anymore. Do you think I'm getting tolerant? It's not that they're getting tolerant. It's that their nitric oxide levels are dropping. So I created a supplement called Affirm, which is available at affirmscience.com. And what that does is it boosts circulation all throughout the body. So it's great for athletes. It's great for blood pressure. It's great for short-term memory. And it's great for helping guys get erections.
Sweet. Saved rounds?
What?
I said saved rounds. You got anything else that I don't want to?
Oh man,
I don't want to close it out. I know you could keep going, but we're at about an hour mark right now.
You got it. Well, this was really, really fun, and I've worked at VAs for a long time, and I have a ton of patients who are military folks and in family, and it's an honor to speak with folks in that community.
It's been an honor having you on. I always like to hear, advice from the experts, and we definitely got that here with Men's Health. So Judson Brandeis, MD, guys, pick his book up, 21st Century Man. Get in the know about your own body, about your own injuries, guys. Pick it up, like it, share it out to the people that need to know it. Dr. Brandeis, I appreciate it. Thanks for the time.
Awesome. Thanks for having me on. I appreciate it.
All right, guys, just getting done, and Dr. Brandeis is off the hook. He had a quick out. We may try to get another look with Dr. Brandeis. I had a good time there and learned a lot. Not a doctor, and I know that a lot of guys in our community suffer from that low T. Talked a little bit about THC and the different components, how that's helping PTS in this episode as well, which is something I wanted a clinical view on. So, Matt, what you got on him?
Good episode. When you first told me we were going to have him on, I was like, doctor, this and that. And I was like, I don't know if it's going to be what kind of episode it's going to be. But first of all, he's a character. He's got some pretty good, funny jokes in the episode, But he puts it in terms that someone who's not a doctor can understand. He can break it down, and he can articulate it to where you can understand it, which is what I liked about that episode. It's good information. And the other thing I liked when you guys were discussing marijuana, the fact that he said he's not an expert on it, the fact that I don't know it all on this stuff. I had to do a lot of research. That's what he said basically. And that's always something to me when I'm watching someone talk about a topic. If they say they're not an expert on it, but they're going to say what they know or what they've researched, then I tend to pay attention more than someone who says he knows it all. Because there's very few topics in this world that anybody knows it all on, even when they're considered an expert.
That's a fact.
Yeah, that's all.
Fact. And that's moving forward. I know the VA's moved forward with several different experimental studies on different therapies and therapeutics and medicines, and there's still a lot of guys that can benefit from that if the lobbies would get out of the way and the bureaucracy would get out of the way. But hey, we'll take the small wins as they come and get these guys treated and get them feeling better. I had a great time talking with Dr. Brandeis and especially, the marijuana part, that was a very interesting part, especially in the book. Reading that monster is something that you want to stow away some time for. I mean, you're talking about several hundred pages of content, but all that relate to men's health in a positive way, and gives a depth of information regarding the 21st century man. So everybody out there, pick the book up. It's good. It's a good resource to put up on the counter. And one day when you're experiencing some of this stuff, maybe you can just pull it out like a go-to roadmap for what you should do next. This interview was brief, and we only covered a couple of sections of the book. There's so much information inside there. You guys need to go get on it and put it on your shelves for sure. Matt, you got anything else?
I'm good.
All right, guys, that was Dr. Brandeis. Thanks for hanging with us. And remember, hit that share, like, subscribe, whatever platform you're following on. And if you took anything away from this, anything struck you, go ahead and share that out to your crowd, share it out to your social media platforms, and let's get this good information passed. Until next time, guys, we'll see you later.
Thank you.
Louisiana Gun Shop, your firearm headquarters, specializing in concealed carry guns, ammo, and training. You can get your Louisiana permit with us. Also a large selection of AR-15s, or if you are that build-it-yourself type of guy or gal, we have all the parts to build and customize your own AR-15. Glock, SIG, Taurus, Ruger, we have all the brands, both in the store or at LouisianaGunShop.com.
Not too far. You're marking the building. Hit him. Yeah, that's good. That's a good shot. That's money. Yeah.